Hello, my name is Dr. Tonia Winchester, and I am joined by my colleague, Dr. Jeannie Doig. We are both naturopathic doctors on Vancouver Island. I practice in Nanaimo, and Jeannie practices in Port Alberni and Tofino. And today we are going to have a conversation about sleep health, sleep hygiene, and how stress is going to impact all of that. So hi, Jeannie.
Hi, Tonia.
How are you today?
I'm good. How are you doing?
Excellent.
Sleep is such a hot topic, right? So important for our overall health. And let me know, what happens with stress and how that affects your sleep?
Yeah, so stress is, and we're probably all experiencing some sort of stress right now. Certainly the patients that I've been talking to have been telling me all about their stress of this crazy time. And everybody that I've talked to has sort of a different flavor of that stress. But essentially, no matter what that flavor is, it's going to look the same in the body. And there's certain chemical processes that happen when we're stressed. And the first thing is there's a release of a hormone or a neurotransmitter called adrenaline, and also the hormone cortisol. And cortisol, you hear about it all the time, right? It's a big topic, and it's a big topic because it has such a widespread effect on our physiology. And the most important thing when it comes to sleep is cortisol is going to suppress melatonin. And we'll talk a little bit more about melatonin later on in this conversation, but melatonin is our sleep hormone, and we need it active to make sure that we're getting the sleep that we need, and not only in terms of time, but in terms of quality. So sadly, when we're stressed, cortisol is going to suppress that melatonin. And this is going to make for a few various sleep patterns that we'll see commonly. One would be not being able to fall asleep, and one would be not being able to stay asleep. So you're waking up and feeling restless in the night. And we commonly see that sort of 1 to 3 a.m. Sometimes it's a bit later, 3 to 5 a.m., where people are just alert, awake, and they're not able to get back to sleep. Mm-hmm. So that's really how stress is going to actually affect our sleep quality and also the quantity.
Mm-hmm. Yeah, that 3 to 5 a.m. also in Chinese medicine is correlated with the liver. And when liver, in energetic medicine, liver qi stagnation is related to stress. So people waking up at those times, it means their liver is stagnated in Chinese medicine.
Yeah, that 1 to 3 a.m. mark is liver, right. Absolutely. And then 3 to 5 is lung. And whenever patients kind of waking up in that 3 to 5, I'm thinking, okay, lung is about it's about letting go, and it's about grief. So is there something that they're sad about? Is there a loss? And, certainly at this time that we are in human history, there's a lot of that. There's a lot of change to our routines, a lot of change to our jobs, finances, our relationships. So it makes a lot of sense timing wise from an energetic perspective too.
Yeah. So tell me, Tonia, why is sleep so important?
Oh, golly. There's Health Canada has data on this, that sleep deprivation is correlated to all chronic illnesses. So whether that's cardiovascular disease, diabetes, cancer, on and on, even mental health, especially mental health right now. So sleep is important for every single system in the body to function well. We need sleep to improve our immune system. We need sleep to, recharge our energy, of course. Interestingly, sleep is how we actually learn. It's where we process our memories and process our emotions as well. Sleep is when we sort of connect into our intuition in a lot of ways, and so into our higher guidance system. And one of the really interesting things that is getting a lot more sort of research and data around it is something called, you can either call it the G lymphatic system or the glymphatic system, but it's basically this circulation of fluids within the brain that happens in our deepest form of sleep, or our deepest state of sleep, that actually cleanses the neural tissue. It releases toxins from the brain and moves it out so those things can leave the body. So sleep has such a profound impact on our physiology. It's when we heal, it's when we actually do most of our digestion. And it's, like I say, when we recharge our, of course, physical, but also our emotional energies. And so if we're not getting the right amount and the right quality of sleep, we are going to wake up feeling tired, anxious. Our digestion is going to be off. Our immune system is going to go down. We're going to have memory problems, hormone imbalances. Like the list goes on and on and on. So this is such a key component. And, you know, I'm actually really pleased because there's been sort of this revival of the importance of sleep in the last little while. I know Arianna Huffington has a book out called Thrive, and it's actually all about sleep and how important it is. And so it used to be this sort of badge of honor, you know, I only get 5 hours of sleep, I'm fine. It's like, no, you actually need that 7 to 9 to fully replenish your body on all levels.
So true. It's so important. Even stress to patients who maybe are trying to lose weight as well, that sleep is so key because those appetite suppressing hormones as well are secreted, and your metabolism is, everything gets secreted when you're sleeping. So you crave more the next day. You crave more sugar because you're overtired and you didn't get that sleep. So you'll eat more. And studies show people that sleep more have a better success losing weight than people that don't sleep enough. So contrary to what we think, right?
Exactly. It's so key. Absolutely.
So do you have any tips or techniques to help improve sleep?
Yes. So it's funny because when patients come to me with sleep issues and I suggest some of these things, they're like, well, I don't have time for that. And in my mind, it's like, well, you're not sleeping. So of course you have time for it. Maybe you have 2 hours when you're tossing and turning in the night that you can actually do these practices. So the things I'm going to suggest take maybe 10, 15 minutes, and they're great sort of wind down ideas before bed. And one of the most important things that we're learning a lot more about now is the blue light, and the screen time really has to go. So I usually suggest my patients at 8 o'clock, turn off all the screens, shut down all the electronics, and just do quiet things like maybe reading or having a nice bath or having a nice cup of tea. That being said, I do suggest not drinking too many liquids before bed, because then you're going to be waking up to go to the washroom in the night, which is also really disruptive, right? And sometimes that's enough to turn someone's brain on so that they stay awake and alert when they should be falling back asleep. So nice sort of routine. And I would say wind down time starting around 8 p.m. There's really good data that shows between 10 and 12 is when the majority of our melatonin is produced. That can actually kind of carry us through the night. So that key window early on, 10 to midnight, it's good to be sleeping in those 2 hours. And we'll often hear patients getting their second wind and kind of staying up late. You really want to train your body, retrain it to go to bed at around 9:30 or 10. And so some of the strategies that I like to suggest, besides sort of the no electronics, no blue light, is yoga nidra, which is a sort of a meditation that comes out of yogic practices. You can find stuff on YouTube. And it's sort of it's kind of like a contemporary body scan where you're sort of, you know, reviewing in your mind how each body is feeling. And there's this really deep relaxation that comes out of it. And from that deep relaxation, you can slide into sleep. One of the techniques that I'll teach my patients is something called the rainbow adventure. And this is actually when you go through the colors of the rainbow with each of your senses. And so what I mean is, in their mind's eye, they're going to say to themselves, I see the color red, and then take 2 nice deep breaths into the belly. And then they're going to say, I hear the color red, even though that doesn't make sense logically. For the purpose of this process, it works beautifully. And then 2 nice breaths. And then I smell the color red, 2 nice deep breaths. And what this does is takes us out of our beta brainwave state, which is our alert, vigilant, safety, checking out the world brainwave state, and takes us into the alpha state, which is that kind of really funky place between being awake and being asleep. So what people will do is go through the entire rainbow with all 5 of their senses. And it has the added benefit of the breathing in between. It's shown that even just 11 minutes of deep breathing is going to triple our melatonin when we sleep. So those are some suggestions. Blue light, no electronics, yoga nidra, or the rainbow adventure, and even actually something else called yin yoga, which is a lovely, gentle, kind of more stretching, restorative yoga. That's really awesome too for sleeping.
Great, thank you. That's great.
Yeah.
Great technique we can start to use.
Yeah, and they're free, right? They're simple. You can access them anytime, right? And it's important to keep in mind that these things are a practice. They may not work the first time. It may take 2 or 3 times of trying them before they actually make a difference to your physiology. And with that in mind, I actually want to hear about one of the biggest habits that humans have, which is about food. So Jeannie, can you tell me about the role of nutrition and sleep?
Yeah, so the biggest, most important thing about nutrition and sleep is that our blood sugars are balanced at nighttime. So one cause for insomnia is low blood sugar. So when blood sugar drops too low at night, cortisol and adrenaline go higher. So that makes you anxious and you just can't sleep when cortisol and adrenaline are higher because it depletes your melatonin, right? So really important your blood sugars are balanced. So making sure you're not eating sugar right before bed or alcohol, which will cause your sugars to go up and down. So the alcohol might help you initially fall asleep, but if you won't go into the deeper REM sleep with alcohol, it prevents that deeper sleep because it will, eventually it will spike the sugars and then it will drop. Any kind of sugary, snacky, junk food before bed is not a good idea. But a snack before bed with a bit of protein and complex carb sometimes is a really good idea for somebody, say, that has a smaller dinner or an earlier dinner at 6 o'clock or earlier. You might need that protein snack before bed to just keep those blood sugars balanced. So just some almond butter and a brown rice cake could do it, or a banana and some almond butter as well, or an apple and some nuts, some almonds. Those are a good complex carbohydrate with protein, will keep the blood sugars balanced so they're not dropping too low.
Yeah, that's such a key point.
Yeah. And the other nutritional piece is caffeine. So some people are really sensitive to coffee and they can't have any all day and it would affect their sleep at night. Other patients just need to make sure if they are having caffeine, it's before 3 o'clock because it will as well rev you up and obviously, destroy the sleep. So those things are probably the most important things.
Yeah, absolutely. And I think we talked in our last video about how some people are just slow coffee detoxifiers. So, if sleep is an issue for you, you have to consider coffee to be a factor. You have to consider that caffeine piece. Absolutely. So I want you to elaborate. Can you tell me more about melatonin, hormones, all of the sort of biochemistry that's happening for sleep ideally?
Yeah, so melatonin is a neurotransmitter secreted in the brain in the pineal gland. And it is a very primal neurotransmitter. So it gets supposed to be, if we're balanced with nature and with the earth, it should be secreted at night. And the lowest melatonin is in the morning when we first wake up. And then right at bedtime around 9 or 10, it starts to increase so that we can sleep. Disruptions in melatonin occur with high cortisol. It's completely correlated. So when you wake up in the morning, you're supposed to have high cortisol and low melatonin. And when you go to bed, it should be the opposite. Melatonin goes up, cortisol goes down. But when there's dysregulation in cortisol, if somebody has a lot of stress and their cortisol is up at night, melatonin will be down. So it's directly correlated with your stress. Melatonin has many benefits, not just sleep. It actually is a really great antioxidant. It's really important for the immune system. It's good for anti-aging. There's studies on it for fertility, for cancer. It's a great neurotransmitter that our body needs. And as we age, studies show that the body does become naturally depleted in melatonin. So some patients need to supplement with melatonin. Now, there's a few different types of melatonin you can supplement with. There's just regular melatonin, and then there's sustained release melatonin as well. So patients that can't initially fall asleep usually benefit from just regular melatonin, and patients that have trouble staying asleep benefit more from sustained release melatonin. Now, melatonin is something that's not addictive. It's not something you have to take long term. I find patients just sometimes need it for 6 months just to restore their melatonin, and then they're fine, and the benefits last. There's no harmful side effects. If anything, it has other benefits with, the immune system and the antioxidant benefits. And I also tell patients, give it a bit of time because sometimes it doesn't work the first week. Sometimes you need a good month of taking it every night before you'll notice the benefits. So definitely that's one thing to help. Natural ways to increase melatonin, again, is balancing the cortisol and avoiding blue lights in the eye right before bed. Another thing you can buy is a light box that you can get on Amazon. It's a circadian light box that you look at for 10 to 15 minutes every morning when you first wake up. And this will set your circadian rhythm so that the melatonin goes down in the morning and comes up at night. So a great way naturally to start rebooting your system so that melatonin is secreted when it's supposed to be. Shift workers, people with jet lag, again, they are very much dysregulated in their melatonin because the bright light is in their eye at night and it should be Once the bright light's in your eye in the morning, it regulates you. So going camping, looking at sun, that helps regulate your melatonin too. People find they sleep better when they're out in nature. And that's part of the reason is we're more in touch with the earth and more in touch with our natural melatonin rhythm. We're dysregulated when we have, too much blue light, too much internet, all these, these frequencies, or too light in your bedroom as well. You need dark in your bedroom at nighttime. Really important. I tell people get blackout curtains. Making sure your room is dark and there's no electronics in your room. If you have any alarm clock with bright lights in your room, move it out of the room. Put it in the hallway. Put your phone in the hallway. Nothing should be in your room with any kind of electronic or lights that could affect your melatonin production.
Yeah, the darkness is just as important as the light in the morning. The darkness is at night. So just to, those rhythms that you're talking about. I often will suggest an eye mask for people for that same reason.
Yes, eye masks as well. One more thing I want to talk about is progesterone. So women, as we age and go through perimenopause, menopause, progesterone levels go down. And over 50% of women have insomnia because of this. Progesterone is your natural anti-anxiety hormone, and it helps your GABA. I mentioned this in our last talk. It helps promote your GABA receptors so that you're able to sleep. So some women benefit from bioidentical hormone, progesterone, as well for sleep.
Yeah. And I was wondering, do you have experience with the topical melatonin? I'll find sometimes the half-life, as you were mentioning, of the regular serotonin, melatonin is really good for that getting to sleep. The half-life in the body is about 4 to 5 hours. But then the topical actually has a longer half-life of about 7 to 8. Do you use it at all with patients? I really find it a nice option.
Oh, good. I just use the sustained release oral, and I find that works for the staying asleep. But either or, it's a great recommendation as well.
Okay, lastly, do you have any other supplement recommendations for sleep, health, and hygiene?
Yeah, so first of all, I want to get the patient's adrenal glands figured out. So I often will test the cortisol, and I can also test melatonin, but the cortisol, we want it high in the morning, low at night. And if it's a reversal curve, you're in what's called adrenal dysregulation or adrenal fatigue. That was the old term. Now we call it adrenal dysregulation, when cortisol is low in the morning, you feel exhausted when you wake up, and it's high at night and you're revved up and can't sleep. You have a reversal curve of cortisol. So we want to balance adrenal. So what I want to give patients are herbs that are going to boost cortisol in the morning and lower it at night. So things like vitamin B, B5 especially helps with cortisol production in the morning, rhodiola, ginseng, ashwagandha, herbs like that for adrenal support in the morning. And then herbs to lower cortisol in the evening, like phosphatidylserine, GABA and theanine, calming herbs as well in the evening. But a few specific ones for nighttime is the magnesium bisglycinate. This works like a charm for any kind of anxiety, stress, just relaxes the whole body. It's a natural muscle relaxant. I like the bisglycinate form because it's bound to glycine, which is an anti-anxiety neurotransmitter as well. So them together combined, magnesium bisglycinate is a great sleep aid, natural, no side effects unless you take too much. You could get diarrhea. So just watching the amount. Lavender is a wonderful sleep aid. This can come in a little pill form. It works for anxiety as well. Great for sleep as well. Like I often suggest patients to use a lavender oil in their bath before bed, lavender oil all over their room, even in their bed sheets. Couple drops on their pillowcase before bed. I love natural lavender cream as well. You can rub it all over your body before bed because it's going to help you relax and sleep. It's a wonderful sleep aid. One more, theanine. I talked about this last time. Theanine lowers adrenaline, so it's a great one as well before sleep. So just some natural sleep aids, but for foods too. So there are foods that are high in melatonin. So bananas, walnuts, almonds, goji berries, these are all good nighttime snacks because they're high in melatonin too. Some natural ways to, if you don't want to take supplements as well.
Yeah, it's nice to have a food option for some people too, right? Yeah. Awesome. Okay. This is good stuff. I'm like, I want to take notes on all.
It's such a big topic.
Maybe we can see if there's any. Maybe we can see if there's any questions on Facebook. If
I don't see any.
You don't see any? Okay.
No.
Perfect. So thank you for the chat today. I'm loving these conversations, and I hope they're helpful for you, the viewer. If you have any specific questions or topics you want to have us chat about, feel free to reach out via the comments or even a DM. p.m. on Facebook. Right. And we will be back next Saturday for a discussion on digestion and optimizing that, especially in times of stress. There's sort of overarching umbrella topic of stress throughout all these conversations. And that'll be 10 a.m. and that will be on Dr. Jeannie's Facebook page. So
Wonderful.
We'll be alternating each week.
Can't
Awesome.
wait.
Thank you, my dear, and enjoy your Saturday.
Thank you so much. Have a good day.
Bye.
Bye.